Great. Well, hello everyone, and welcome to today's webinar for the AI Nurses Network. We've got a great nursing researcher, Dr. Connie Chong, who's an associate professor in Hong Kong, and she's going to talk about artificial intelligence for mental health therapy. So over to you, Connie.
Okay, so thank you very much. And it was a great pleasure for me to able to share our work regarding how we integrate artificial intelligence into acceptance and commitment therapy, and for providing a tailored mental health. And my background is a registered nurse in Hong Kong, so probably I have received specialized training in pediatric care and also medicine. While particularly I am a little bit shift my career in research related to psychotherapy and acceptance and commitment therapy. That is the therapy that I really love at. And I'm now trying to integrate this kind of psychotherapy by using artificial intelligence. And apart from my position as associate professor as a school, that is the National School of Nursing Faculty of Medicine, the Chinese University of Hong Kong. I'm also the CEO and founder of a startup called Actualize Limited. And actually, we are now trying to transforming our research into impact, a real impact that has been making beneficial to Hong Kong and also to mainland. So see if this is working. Yeah. So here is some kind of the mental health healthcare landscape analysis, like in Hong Kong and also in mainland China. So if you take a look about the market profile in Hong Kong, like we have over 7.6 billion Hong Kong dollars that has been spent in providing mental health services and also in training, while for the market, like in mainland China, is even larger. And if you try to compare the statistics in Hong Kong and also in mainland, you could see that probably we have around almost 1 million of individuals in Hong Kong. They suffer from various kinds of mental health problems, while in the mainland China is even higher, particularly for the prevalence rate. It is almost 20%. And you could see that for the public waiting time, that is to say, if you have issues in mental health, you have an inquiry and you would like to seek for mental health support, probably you need to wait for at least 7 days to almost 140 days for receiving a proper outpatient psychiatric services. And you can see there's a kind of a long waiting time. At the same time, not only on the mental health service, but also for the mental health training, we have a kind of a huge deficit. Actually, in Hong Kong, particularly for the professional ratios, we have like around 4.5 psychiatrists per over like 100,000 of the populations in Hong Kong. So probably we do have a lack of mental health professionals that could provide mental health support to the people in Hong Kong. And I'm not pretty sure about the price in UK or like in other countries, but actually if a person they have issues regarding mental health and they would like to seek for counseling service, usually for uh, each counseling session, it will cost around like 800 Hong Kong dollars. That will be 100 US dollars per session. So probably you could imagine if we want to receive a traditional counseling sessions that is ranged around 8 to 10 sections, it is quite costly and pretty not that affordable to every individual. So in general speaking, there is a kind of a lack of mental health uh, services that could be really reachable and accessible, but at the same time, we do have a lack of mental health professionals who are qualified to provide mental health support. So acceptance and commitment therapy is a kind of a third wave of psychotherapy. And you can see that in the diagram on the right-hand side, what we're targeting at is to foster someone's psychological flexibility. And we are not focused on like helping the clients to reduce the symptoms, like the symptoms of depression, anxiety, but we are much more focused on how to help the clients to improve their well-being by by introducing the principle of acceptance, mindfulness, and values clarifications. And actually, in our talk therapy, that is the acceptance and commitment therapy, when we are doing the counseling sections, we will try to juggle around in all these kind of therapeutic process so that let the clients to become more psychologically flexible. And in the evidence, actually, we have over a dozen of clinical trials globally affirm that ACT interventions do help to improve someone's mental health, and it is durable. Like if you do your ACT intervention well, you could able to achieve over 30% of reduction in terms of the mental health symptoms, and clinical trials have shown that the effect has been sustained over 18 months. And it is quite rapid adopt in Asia. Actually, starting in my 2019, my first clinical trial that we do ACT interventions for parents, that is what we call acceptance and commitment therapy. We find that more and more clinical trials, they are trying to use ACT. So this is pretty emerging. And this is a kind of a training model like ACT that could be extended beyond the psychologist. That means not only clinical psychologists or psychiatrists can do it. For mental health professionals or for paraprofessionals like counselors, nurses, social workers, if they have received adequate therapy training, they are qualified and able to deliver this ACT intervention with fidelity. So this is a kind of a training model that could further extend it and could broaden the usability to various kind of frontline practitioners. So actually all these are at work. We have published extensively in introducing how ACT intervention could be able to help, and my target area is on how to use ACT interventions for supporting parents of children with various kinds of chronic conditions, like children with asthma comorbid with ADHD, children with eczema, like individual with psychosis. And usually what we did is various kind of clinical trials. And at the same time, you can see that in the left-hand side, we also have published our training protocol. That means we have developed our first acceptance and commitment therapy training program so as to train over 300 of paraprofessionals in Hong Kong so that they could acquire the skills to serve the people they need, like the families of children with special healthcare needs. At the same time, we also conduct various kind of systematic reviews and meta-analysis to showcase whether ACT interventions could work in other population groups. And other papers also include in understanding the concept and also the role of psychological flexibility to see whether this concept will do work in supporting mental health as well. So actually, there's an increasing number of evidence starting from like in 2024 and 2020. And actually, this is not an intervention that we deliver in a traditional way. You could see that starting in the 2008 onwards, there are multiple ways of delivering as interventions. For example, doing in a group-based approach, or like integrating acceptance and commitment therapy to other evidence-based disease management programs, or doing ACT interventions in a mobile-based approach or in an online-based approach. So there are various ways of how we integrate ACT in our evidence-based practice. But at the same time, we also encounter an issue regarding a lack of personalization. So actually, acceptance and commitment therapy, similar to various kinds of psychotherapies, usually what we did the intervention is pretty like protocol-led interventions. That means we have written the section plan, we have established our own acceptance and commitment therapy metaphors and experiential exercise, while we follow the protocol and then execute it. So this is a kind of a protocol-led intervention. But sometimes we also have issues we would like to ask whether these interventions could really tailor to the client's needs. And actually, in a recent paper published in the Lancet Digital Health, the authors have echoed that how artificial intelligence could able to demonstrate a role in providing personalized mental health care through, for example, like in the left-hand side showing variability in the patient's reporting. Very often we rely on the patient's subjective description on the symptoms, and there are lead to inconsistency in diagnosis. And very often we rely on the diagnosis so as to inform whether the clients could move to the next steps, like receiving the treatment. And at the same time, we also heavily rely on the clinician accurate integration of the emotion and cognitive states. And we are still wondering whether AI could help us to play this role in how we could integrate various kinds of information so as to map out a more appropriate decision or more appropriate intervention for these clients. So in overall speaking, mental health interventions, they encounter an issue regarding tailored and also the personalization. And sometimes maybe AI could help us to play the role. So in here, actually in this presentation, I would like to introduce our mobile application called PiS. And actually we are not simply focused on mobile app anymore. We are moving on the second stage right now. So at here, PiS is a mobile application that is built on our AT large language model, particularly served for service users and also the frontline practitioners. So this is all in Cantonese. We are trying to launching a prototype that is in English, but actually this is a mobile application that actually serves for the parents of the children with special needs. When the parents download the mobile application in a free of charge, they could chat with the mobile app for around like 20 minutes, and you could use the voice to text function to chat with the mobile with the AI chatbot. And actually the questions generated from the AI chatbot is mimicking a scenario that we encountered in the first acceptance and commitment therapy counseling section. So our app will be able to do an instant analysis regarding your chat message and identify precisely what psychological inflexibility areas that you have issues. In the previous discussion, we have been talking about like what does it mean by like protocol-led intervention. Previously, if we do a protocol-led at interventions, we have to help the clients to walk through all the processes. But now, if we use an AI chatbot, our AI algorithm could able to do a textual analysis to understanding in what processes that the clients they do have issue. So in that way, we are able to provide a process matched at interventions that is particularly tailored for this client. And I have to say, in order to having this kind of intelligence and analysis in understanding a client's psychological inflexibility process, previously without AI, we required an ACT interventionist or counselor to have at least 5 years of counseling experience. But now, by relying on AI to do the first stage of the screening and analysis, we are able to shorten the counseling therapy time from like 60 minutes to less than 20 minutes. So the second feature is about our tailored ads digital sections. In the previously, we have showed our AI chatbot the way of how we work. After that, if we identify the clients that he or she is in the low risk of the depression and anxiety, evidence has shown that self-help materials could help. And the self-help materials that we are providing is tailored according to the psychological inflexibility process that they have issues. For example, one flexibility process is about like cognitive diffusion as shown in here. This is written in Cantonese, but in the previous chatting history, if we identify this process is the first area that the client need to be addressed, then the tailored sections, that is the like the audio records or the self-help materials that is specialized for this process, that is cognitive diffusion, will be provided first. So actually the self-help materials that we are providing is according to the client's psychological needs, not like a protocol-led intervention anymore. So this is all the like the screenshot showcase our ACT metaphors and experiential exercise. And then for the third feature is about our triage system. Actually, when you chat with our AI chatbot, if we identify that you have the risk of self-harm or harm to the children, because as we are focused on helping parents taking care of the children with special needs, if we identify there are these kind of language patterns, or you have like a moderate risk of depression and anxiety, we will triage you to receive in-person acceptance and commitment therapy. That is to say that you our counselor team will reach you, and then we'll offer altogether 4 to 6 acceptance and commitment therapy counseling sessions. So that is to say, we are not solely rely on our AI chatbot to provide a platform for you to chat, but we use our AI to do a textual analysis in understanding a client's psychological inflexibility status according to the principles of acceptance and commitment therapy. But at the same time, we are triaging at-risk cases so as to receive in-person counseling support. So this is the entire journey. The parents download the mobile application free of charge, chat with the AI chatbot for around 20 minutes, mimic the first acceptance and commitment therapy counseling section, and then we will generate an AI diagnostic report to show what acceptance and commitment therapy processes that you have issues. If you are being identified as low risk, then you'll receive the tailored ad intervention materials, which are the audio records and reading materials, that is related to mindfulness exercise or like as metaphors or experiential exercise. But if you are at the risk of like depression, anxiety, you are being triaged out and received online counseling section. So this is our second product, that is an AI ad training platform. The previous product that we focus on is to use artificial intelligence to provide acceptance and commitment therapy, mental health support. But in here, we are now using artificial intelligence to provide an acceptance and commitment therapy training platform. So here is, I hope I could share the, can you hear me? Yes?
I can see the video looks great, Connie. I can't hear the audio, but I can see
Oh, you can see. Oh,
yeah.
oh. Oh, sorry. So
Don't worry.
basically, this is all kind of a video demonstration. In fact, we have the audio actually. But this is a video demonstration showcase that our acceptance and commitment therapy counselor that he could now engage with the virtual clients by chatting with our virtual clients, and the virtual client is trying to mimic a parents that they are struggling with depression and anxiety in taking care of their children with special healthcare needs. And then in our entire virtual client ad training platform, our platform will be able to tell the ad counselor, like show in the right hand side, which sentences that are in which sentences that they have been uh, talk accurately according to the counseling principles, because acceptance and commitment therapy, they do have principles to follow. And then as an ad counselors, by using this virtual client training platform, he could learn whether he is now speaking in a way that an ad counselor should able to speak at. So this is a kind of a virtual client training platform. We are mimicking a simulation training platform, so that actually at the beginning of an ad counselor's, before he go to the supervised practice, that is going to the real life practice, he could use this kind of virtual client training platform to learn the skills, communication skill in doing acceptance and commitment therapy counseling, and then go to the supervised practice. So this kind of AI training platform is at this stage is a prototype stage, but we are helping to bridge up the gap in the transition for learning the theoretical underpinning of ACT to a supervised practice. So for the entire journey of our development, we started in 2021. So in the 2021, we received various grants in supporting, we do clinical trials regarding that intervention. So we built our AI model by using real counseling data. That is the acceptance and commitment therapy counseling sessions. They are anonymous and being annotated. And then we have go through the entire pipeline in developing our own AI model by integrating the deep learning robotic BERT-based model together with the ChatGPT 4.0, so that we allow our AI model to able to do the textual analysis of the client's psychological flexibility. And we have patented the entire technology. And currently we are doing the randomized control trial study to see whether our PyEdge mobile application versus usual care, whether this could help to improve improve parents' mental health. And at the same time, we are also working with the social welfare department of the government to see in an implementation science perspective, if we try to implement the mobile application PyEdge into the market, what will happen? So basically the entire process, starting from invention to building our AI model architecture to the clinical trial, is we spent around like 4 years to do it. And right now, we are at the preclinical stage in developing our AI acceptance and commitment therapy training platform. We are at the stage of the model architecture design and also the validation stage. So actually, this simulation training platform hasn't been launched to the market yet, but for this mobile application has been launched to the market since November 2023. So this is part of our data to show that whether our AI model could be performed as similarly as a human therapist to detect the client's psychological inflexibility. And you can see that for each these letters actually is a abbreviation indicating the psychological inflexibility process. And that you can see that from the ROC curve analysis, you can see that the scores from 0 to 1 actually the more closer to 1 that to demonstrate that your model to analyze that particular process is much more accurate. You can see that actually our AUC curve analysis with the index that is around like 0.8 to 0.9. So it is pretty accurate when compared to a qualified at acceptance and commitment therapy counselor in understanding a client's psychological inflexibility process. While in the study 2, we are trying to compare our AI model to the existing markedly available AI model, and you could see that our performance of the AUC curve in terms of the AUC index, you can see that our performance is also much better than the other market available models. The reason is because our model is domain specific. That is, we use the real conversation data and no data to train it rather than the generic model, so that actually our model is able to outperform with the other AI model as well. So in terms of the achievements so far, our team has attained over 30 million Hong Kong dollars in the various research fundings. And our mobile application PyEdge and also our AI model have launched over 20 press release and media platform, 3 international patents awards, 3 international patents, 5 international awards, and we are one of the top 10 Startup Express, that is our startup company, because we are trying to scale up our invention, not only focus on research anymore, but we are now launching our entire AI model into more commercialized and more in back to the community. And altogether in the portfolio in Hong Kong, we have 10 strategic partners. We have collaborated with various NGOs in Hong Kong, trying to scale up our research and also the application of our PyEdge. Altogether, right now, we have served over 2,500 families in Hong Kong. And altogether, our preliminary data shows that these families, after they receiving our PyEdge mobile application for tailored mental health support, they have achieved over 32% reduction in terms of their parental depression. And altogether, our team has also trained over 300 of community workers so as to certify they have the skills in doing an counseling, so that we are able to collect a large corpus of the conversation data between an ad interventionist and also the users, so as to continuously train our AI model. So ActWise Limited is our pioneer spin-off startup from our school, also from the Chinese University of Hong Kong, and we are specialized in integrating artificial intelligence and acceptance and commitment therapy so as to provide technological innovative solution in mental health care. And the right-hand side is all my team members. And here is the I think that is the end of my slide. Actuals Limited. We are one of the top 10 startup company in Hong Kong right now. We are trying to launch and scale up our AI integrating acceptance and commitment therapy, mental health training and service in Hong Kong. And we are starting to expand our impact not only in Hong Kong and in mainland right now. So this is the photos show in the right hand side is our is one of the office that we have launched in Shanghai. So that is the end of my presentation. And on behalf of team, I would like to thank the various funding agencies in supporting our entire project, including our Chinese University of Hong Kong, ITC from the government, UGC from the government, and also from the HKSTP, Hong Kong Science and Technology Park Incorporation. Thank you very much.
That's great, Connie. Thanks for a really interesting presentation. It's lovely to see the trajectory of the app and the model over a couple of years, because I know it's lots of hard work doing all that technical
Yes.
as well as doing all the research. So I've got a couple of questions before we finish, if that's okay.
Sure.
Firstly, I'm really curious, how did you get interested in doing AI research and get started?
Oh, I get interest in doing the AI research is because I found there is a kind of issues regarding accessibility of the mental health care. And because in previously a lot of mental health interventions, not only in acceptance and commitment therapy, but also various kinds of psychotherapies, you need qualified people and so as to deliver mental health intervention. And it takes time to do this kind of like qualification. And there's a lot of papers showing how various kind of psychotherapies do effective. But when you put it into the real life practice, there are issues regarding accessibility and scalability. And actually, like around 4 years ago, we have been thinking of how technology could able to help us to scale up this in that our intervention. So we have this kind of idea.
Great, great. And do you have any advice for nurses who might be interested in AI, how to get started working in the area?
Oh, how to get started? I think you need to be very clear about the role of artificial intelligence, role of AI, because when you try to do this kind of research, there's a lot of temptation. I mean, the temptation is you could try to use AI to help you to do a lot of things. I mean, you could actually from my sharing, you may know that actually the mobile application, the mobile app that is the Pi app, we are not creating a platform to let the parents to chat for multiple times. And actually, to me, it is a kind of a temptation because if you create this kind of like AI chatbot, allow the clients to chat for multiple times. So basically, you're also able to handle the issue of the accessibility or this issue. But the point is, when you know the technology and the technology could do that further, this is a kind of a temptation for you. You may fall into risk of some kind of ethical issues regarding whether the AI will have this kind of like hallucination and then create a kind of a platform to let the people to check whatever they want to check. So this is a kind of I think as a researcher you need to stand as have the standard and also more firmly regarding how you want to use AI in your nursing care. I think that is very important. Yeah,
Sure, yeah, there's definitely lots of risks with using it.
that's
Great.
true.
And my
That's true.
yeah, my last question's a little bit more difficult because where do you think AI might go in the future, and what sort of trends should nurses be looking out for?
Oh, okay. Generally speaking, I think AI at this moment is looking for uh, majority of the AI research is now on diagnosis and detection. That means because previously diagnosing something or detection something, you need to collect various kind of data in which the data could have a lot of variation. For example, like image, like voice, or like text and all these. But I think as a nurses, our role is not on detection or on diagnosis. Our role is on intervention because as a nurses, well, our role is to provide the care for the people. So as our product and our research, we try to use AI to provide tailored psychotherapeutic intervention. And I think at this moment, there's a lot of focus on detection, diagnosis, and all these. But I think more importantly is how the AI inform the treatment. And we as a human to decide whether the treatment is accepted or rejected. And I think that is much more important.
Yeah, great, great. That's a really important point, I think, especially for those of us in nursing.
Mm.
Brilliant. Well, thank you so much for a great presentation. And yeah, we look forward to seeing more AI research from you in the future. And
Sure.
please do develop an English language version of the app. That'd be great because I think it would go down
Yeah,
really well
sure.
in the UK.
We have the prototype actually, but we haven't
Oh,
launched the market yet. Yeah.
oh, super, super great. Well, we look forward to seeing that arrive in our shores hopefully very soon.
Okay, sure.
Brilliant. Thank you.
Thank you. Thank you very much for the invitation. Thank you.